cylindrical continuation of the central nervous system beyond medulla. So it is present within the vertebral canal. Okay, so that is the spinal cord. So now it has got some coverings, or the meninges. You can see the covering is nothing but the meninges. It has got dura, arachnoid, and pia. 3 coverings. And the pia matter, that the most intimately in relation to the, whether it is brain or in the spinal cord. Okay, that is called pia matter. So it remains, is a true friend. It is known as a true mother. Okay, it covers all the area, and that pia matter actually gives, here we can get different types of modification of the pia matter. Okay, we can get the different modification, and first modification is known as the ligamentum denticulatum. Okay, we can get the ligamentum denticulatum. So the pia matter is that through the pia matter, through that denticulatum, it is attached to the inner aspect of the dura matter. Okay, so ultimately this gives the support to the spinal cord. What are the supports of the spinal cord? First is the bony canal, the vertebral canal. Second is the ligamentum denticulatum, what I am saying. Okay, and now what is the length of the spinal cord? It is the 18 inches in length. Okay, 18 inches or 45 centimeters. 45 centimeters in length. Okay, so it is present. So what is the extent? Extent is the beyond medulla. That is the upper border of the atlas. Upper border of the atlas, or the middle of the odontoid process of the axis. Odontoid process is the second cervical vertebra. So that is the junction between the medulla and you can see here, that is the ligamentum denticulatum. So the teeth-like projection, there are 21 pair of teeth-like projections they are coming out. That is nothing but the ligamentum denticulatum. That is the modification of the pia matter. So another modification we can get. Okay, so we know this is the it has got some grooves. Anteriorly we can get anteromedian fissure, and similarly we can get posteromedian sulcus. That is hardly visible, but on other side we can see there is another sulcus, that is the posterolateral sulcus. Okay, anteromedian fissure and posterolateral sulcus, and posteromedian sulcus is there also there at the midline. But we can see very well from here, we can see the grooves on either side. There is a posterolateral sulcus. So anteromedian fissure, within the anteromedian fissure we can get the pia matter also. That is called linea splendens. Linea splendens. Okay, so that is another modification of the pia matter. Okay, now the anteromedian fissure is for one artery, that is the spinal cord is being supplied by 2 arteries. One set from the front and other 2 from the behind. So that is the anterior spinal artery. That is, and this groove is for the anterior spinal artery. Okay. Similarly, we can get the posterior spinal artery. The anterior spinal artery actually 2 in number. Okay. It is coming from the 4th part of the vertebral artery. So ultimately, these 2 arteries actually joins at the level of olive of the medulla, and it comes down, and it remains within this anteromedian fissure. So that is the anterior spinal artery. Similarly, we can get posterior spinal artery. This is also coming from the 4th part of the vertebral artery. Okay, and on either side we can get. So we can get posterior spinal arteries. Now we can see the typical feature of the spinal cord, what we have been taught from our student days. So we know this is inner gray and outer white. Inner gray we can get, and we can see the anterior one is the bulbous one. So that is called anterior horn. Whether the posterior one is slender one, that is the posterior horn. So if I can identify actually the gray matter, that is the anterior horn and the posterior horn, we can also determine which one is anterior, which one is posterior. One is the fissure, anteromedian fissure, okay, by which we can identify which one is anterior one, which one is posterior one. And here we can also find the posterior horn and the anterior horn. Anterior horn is bulbous. In thoracic segment, we can also get the lateral horns. Now, this is the starting point, that is the junction between the medulla, the medulla and the spinal cord, that is the just above the first piece of the cervical vertebra, or which is called the atlas. Okay. Now, where it ends? It ends here. We can end here. It's a conical ending, that is called Conus Medullaris. Conus Medullaris. Okay, that is called Conus Medullaris. From where we can get tufts of nerve fiber which are coming out. We can see the nerve fibers are coming out from the Conus Medullaris. Okay, we can see the Conus Medullaris, and from where the tufts of the nerve fibers are coming out, as if they look like the tail of a horse. So it is called Cauda Equina. And in the midline, we can see a non-nervous element. In the midline, we can expect one non-nervous element, that is called the Filum Terminale. That is the Filum Terminale. In the middle one, that is the Filum Terminale. How many nerves are coming out? The lower 4 lumbar nerves, 5 sacral nerves, and 1 coccygeal nerve. And they divide into 4. Each we can get the anterior horn and posterior horn. Okay, so there are 1, 2, 3, 4, because they are coming out through their roots. Okay, some is entering from the posterior root ganglia, and it is coming out. So we are in one segment we can get 4 nerves. Okay, so altogether from the 10 pair of nerves, that means 4 lumbar, 5 sacral, and 1 coccygeal nerve. 4 into 10, that is, we can get 40 numbers of nerves are coming, and they will come out through the respective the foramina. Okay, vertebral foramina. So they are called the Cauda Equina. Now in the middle we can get the Filum Terminale. So that final terminale has, again we can see there, we can see the Filum Terminale. Okay, and this Filum Terminale is non-nervous element. It is not a nervous element, the non-nervous element, and it gets attached to the dorsal aspect of either of the C1, that is the first coccygeal vertebra, or the second coccygeal vertebra. So it is attached to the dorsal aspect of the first or second coccygeal vertebra. Okay, and it comes out through the sacral hiatus. We know in the sacrum there is a sacral hiatus, inverted U-shaped area, from where this Filum Terminale is coming out. So within the sacral hiatus, that part is coming out, that is called Filum Terminale externum. And within the vertebral canal, what we are seeing, that is called Filum Terminale internum. Total length is 20 centimeters. Among them 50 is the internum and 5 is the externum. Okay, so this is and so we have to identify the spinal cord. Okay, it's very easy one. Okay, that it is not that tough one. So we have to identify we have to identify the anterior horn, posterior horn, okay, and it remains within the vertebral canal. Now, during embryonic stage, what we can get, the whole whole length of the spinal cord remains within the vertebral canal, but due to disparity of the growth of the bone and the spinal cord, so the level becomes changed. Okay, just after birth. So this conus medullaris, that ends at the level of L3. Okay, but after birth, okay, just after birth, we can get the L3 level. Okay, so in an adult one, we will get at the level of L1. So conus medullaris will end at the L1. Okay, so L1, that first lumbar vertebra. So we can omit the second one. So better we can choose either the space between the third and fourth is mostly preferred for choosing the lumbar puncture, because the anesthetist or anything due to diagnostic and therapeutic use, we carry out the lumbar puncture. That is a very popular and very popular procedure, that is called lumbar puncture. Okay, where that is been performed at this below the level of L2, L1, L2 is a dangerous space. Beyond L2 or L3 or L3 and L4, we can choose that area. Okay, where, so what can happen? Nothing will happen, because no fiber we will get there. Okay, we can get actually the dura, arachnoid and the pia, and dura and arachnoid, they end at the level of S2, the second sacral vertebra. Okay, so if I can puncture there, so we can puncture the dura, then arachnoid. That subarachnoid space is important, because there we can get the cerebrospinal fluid, and then we can inject the anesthetic medication. Okay, that is the spinal puncture, and this is the dura. So in between the bone, এদিকে তাকাও মা বাবু, ওদিকে তাকিয়ে কিছু হবে না, পরীক্ষা ওইদিকে যাবে না, এদিকে এসো, ওদিকে হাত নাড়িয়ে এই করে এদিকে এসো, শ্যামবাজার তো তোমার বাড়ি না? হ্যাঁ ঠিক আছে, মনে পড়েছে, ঠিক। শ্যামবাজারে কি এখন তুমি বাগবাজারের দিকে তাকাচ্ছ কেন? আবার কখনো বউবাজারের দিকে তাকাবে, করো না। হ্যাঁ, বাগবাজার, বউবাজার এগুলো পরে, ঠিক আছে, আগে বোঝো। হ্যাঁ, আমাদের ক্লাসরুম বাজারটাকে আগে বুঝে নাও, ঠিক আছে। তো আলটিমেটলি আমি কোন জায়গাটা গেলাম, আটকে গেলাম। So that is the dura matter. So dura and the arachnoid matter ends at the level of S2. So if we puncture, so we can puncture the dura, and we can enter into the, and we can puncture the arachnoid. We can enter into the subarachnoid space. That is important for cerebrospinal fluid, and if we can inject our medication or any other anesthetic medications. Okay, now the area between the spinal cord and the vertebra, here we are getting the dura and we are getting the vertebral canal. So that area is called the epidural space. That is very important, because epidural anesthesia is needed. Actually epidural anesthesia is done through the sacral hiatus. Okay, that is the epidural space. Okay, so that is also, we have to keep in your mind, that is an epidural space. Okay, now what happens? The dura has got peculiarity. In the cranium, we can get two layers. One layer is intimately attached to the inner side of the cranium, pericranium. Oh, that is called endosteal layer, and another is the meningeal layer of the dura, and in between we can get so many folds of dura. Okay, So, in the cranial bones, we can get within the cranium we can get two layers, that is endosteal layer and meningeal layer. But that meningeal layer actually comes out and it covers the rest of the spinal cord. So, in the spinal cord there is no endosteal layer, only that meningeal layer is continued. This is a conception. Okay, only the meningeal layer, no endosteal layer. Now, about the blood supply, anterior spinal artery, that is coming from vertebral artery. Posterior spinal artery, we can get these two group. So, that is also coming from the fourth part of the vertebral artery. Not exactly, we have to say, not from the whole of the vertebral artery. Vertebral artery has part 1, part 2, part 3, part 4. Okay, from the fourth part of the vertebral artery, okay, it is coming out. These arteries are coming out. But these arteries are being reinforced by the local arteries, regional arteries. Like in the cervical region, the deep cervical artery, also from the deep cervical artery, branches are coming to enrich the blood supply of the spinal cord. Similarly, in the thoracic region, posterior intercostal artery, and from the lumbar region, there is the lumbar arteries. Okay, 4 lumbar arteries we know. From there the branches are coming and reinforcing this blood supply. They are called radicular artery. Radicular artery. Altogether, we can get this along the groups. 1, 2, 3, 4 and 5 longitudinal arteries are coming down. Okay, and they are being reinforced by these local arteries, that is the radicular arteries. Okay, local regional arteries. The anterior, and there is a connection between the transverse connection. They are called the coronary arteries. Okay, they are also there are transverse anastomosis from anterior to posterior, posterior to anterior. So there is a corona of arteries. So we can get coronary arteries. Okay. Now the anterior arteries, the anterior radicular arteries, they are, because they have the anterior branch and posterior branch. The regional artery is suppose deep cervical artery divides into anterior and posterior branch. So it gives anterior supply and posterior supply. Okay, the anterior arteries are bigger in size. Okay, bigger in size. They are called the arteria radicular magna. Arteria radicularis magna. Okay, just remember that one. Okay, now, so almost we have to find out. This is the central canal. We have to know this is a white matter outside and inner gray matter. And here we have to, within the white column, it is divided into the anterior column, lateral column and posterior column. The anterior column is here, lateral column is here and posterior column is there behind. And anterior column, mainly actually there were different neural tracts are coming down. Okay. Anteriorly, generally the corticospinal, anterior corticospinal tract